Welcome to the Diabetes Podcast, where we strip away the noise and get to the root of what's really happening with type 2 diabetes and how to reclaim your health and your life. Today we're tackling something that hides in plain sight. It's in your bread, it's in your soup, it's in that sandwich you grabbed at lunch, and it's quietly shaping your risk of stroke, heart attack, and kidney disease. That something is sodium. Now you might be thinking, salt, really? That's the big danger? But for people living with diabetes, sodium isn't just about taste. It can be the difference between living freely and facing a life-altering event like a stroke or a heart attack. In this episode, we're going to cover why sodium matters so much if you're living with diabetes, what the latest research says about high blood pressure, heart disease, and stroke risk, how the average American diet sneaks in nearly double the sodium you actually need, and most importantly, practical steps you can take without giving up the food you love to protect your heart, your brain, and your life. Let's get into it. Hello, and welcome to the Diabetes Podcast. I'm Richie.
And I'm Amber.
And Amber, today we're talking all about sodium.
Yes, your favorite.
It is my favorite.
Okay, well, let's just start in with the numbers, like some kind of recommendations where we are. The American Heart Association recommends no more than 1,500 milligrams of sodium per day for most adults, especially if you've got high blood pressure or diabetes. And the general upper limit is 2,300 milligrams, or so the upper limit recommended. But here's the but. The average American consumes about 3,400 milligrams daily.
Yeah, I unintentionally did some homework for this over the past several weeks, and it's pretty easy to get 1,500 milligrams in a meal. Much less over the course of the day. So I think, listener, pay attention. This one's going to be one of the more challenging episodes to really kind of work towards, because again, just effortlessly, I can far exceed the recommendation on sodium just by what I would consider even eating healthfully.
Well, hopefully by the end of this episode, it will be somewhat effortless to at least cut that down by a quarter. Okay. We'll talk about it. Yep. So, I like plant-based diets. So We're going to compare the 3,400 milligrams, which is, by the way, more than double the heart healthy amount. We're going to compare plant-based diets, which typically clock in far lower. We're talking 1,500 milligrams a day. Simply because when you think about it, fruits don't have salt in them. Vegetables in nature don't have salt.
Not at high amounts. I mean, I think there's a little bit.
Like 15 milligrams, maybe. Like nothing compared to is when you process foods and add salt in as a preservative. Your whole grains and your beans are naturally low in sodium. And the difference is a life and death risk when we really look at long-term outcomes with sodium. And here's the reality. It's kind of everywhere. Sodium is found in...
So if it's not in the fruits and vegetables, and I would say probably even like kind of naturally occurring or unprocessed meats and that kind of stuff. Where's all the sodium coming from?
So most of it's not coming from the salt shaker. That's what most people think. Oh, well, I don't add any salt at the table, therefore I'm okay. Right. Wrong. That would be incorrect, because more than 70% of the sodium that makes its way into the standard American diet does not come from the salt shaker. It comes from processed foods, fast food, restaurant type foods.
You said 70%?
Yes.
Okay. I'm a big letter grade person. To me, it sounds like if I can get a wrap on where most of the sodium in my diet's coming from, at 70% coming from processed foods and restaurant foods, like just cutting that out. I've already passed the course pretty much. You know, I mean, that's
right. And that's why I was saying it by the end, hopefully just as easily you'll be able to identify where this is and tackle that and get it out. So when you think about the foods that Americans eat the most, bread and rolls. We love our bread and we love our rolls, and they don't really taste salty. So you wouldn't think that they're high in sodium, but they are one of the top contributors to salt in the American diet.
And that's all breads?
Pretty much, because if you follow a recipe for bread, you're going to add salt to it. Then secondly would be cold cuts and cured meats, which we talked about last episode.
Based off of the last episode. So we talked about processed meats being a category 1 carcinogen. Did a little more research. It's almost like the only food in the list of category 1 carcinogens.
Right. That was surprising to me. I didn't realize.
Depleted uranium, that made sense. Diesel exhaust. Yeah, that made sense. Asbestos
was in there.
But so we got this list of like very toxic materials and then processed meats. So
that blew my mind that it was in the same.
The club sandwiches are not going to be on the menu, or at least are going to be very diminished going forward.
Yeah, because I think you think, well, everybody eats this. It's in the grocery store. It's available and everybody does it. Therefore, how could it possibly be so harmful? I think it's really easy to dismiss the risk there for a couple things, for cancer risk and for high sodium, a source of a lot of sodium in your diet. Oh, I'm going to hurt your feelings with this one. You ready?
Am I ready to have my feelings hurt? Is that the?
Yeah, that's the question.
At least you're giving me the preparatory, like, brace yourself.
It's like when I say to you, when I apologize in advance for something, you're like, no, I don't want to hear it.
Yeah, go ahead.
Okay, pizza.
Well, that makes sense.
It's sodium bomb with cheese sauce and crust. I know, and I'm not saying you can
that's
never
not going to hurt
have
me, but that will hurt the kids.
Pizza,
they're not going to be happy about that one.
Yeah. Canned soup and sandwiches.
This one I knew. I know that when I add canned foods to anything in general, that usually tends to be, for me, one of the most egregious sources of sodium in my daily life.
And I think you've noticed that probably maybe one can every 3 to 5 years might make it into our house of the Campbell's red and white label soup cans. Like you just don't, you don't see those in our house because they are about 1,200 to 1,500 in and of themselves.
You got me trained pretty good. I don't want to throw any shade on any particular manufacturers, but
that's true. Yeah,
we've been low sodium soups for a hot minute around here.
Gonna hurt your feelings again.
Keep it coming.
Fast food, burgers, fries. Here it comes. Fried chicken.
No.
Often a day's worth of sodium in one fast food meal pretty easily.
Yeah, there's those 1,500.
And here's why it matters if you've got diabetes, because sodium raises blood pressure.
Okay.
And high blood pressure is already twice as common in people with diabetes compared to those without diabetes. And then you combine the two and your risk of a heart attack or stroke just skyrockets.
Is the blood pressure, the higher blood pressure in the diabetes population, is that a side effect of the diabetes, or is it more kind of just let's just call it the behaviors that result in diabetes also result in high blood pressure? Is that? This
feels like which came first, the chicken or the egg? I'm sure there are studies that look at that. I can't really say what I would guess
Mm-hmm.
is that the same behaviors of the standard American diet, overeating, contribute to central adiposity, contribute to higher sodium, contribute to higher blood pressure.
Well, and
Hmm.
you know, if processed foods are a major source of the sodium in the diet, it stands to reason. We've already established
Right.
that there's clearly a link with the quantity of not just processed foods, but particularly ultra processed foods,
Mhm.
and an increased risk in diabetes. So,
Yep. There was this massive meta analysis in the Journal of the American College of Cardiology, which found that high sodium intake is directly linked with a higher risk of major cardiovascular events. And so when I say major cardiovascular events, I'm talking about heart attack, stroke, and heart failure. And then when you have diabetes in the mix, that risk is only amplified.
okay. Do you know how much?
Well, I know that having diabetes puts you at 2 to 5 times higher risk of congestive heart failure, your
Okay.
cardiovascular related complications.
Okay.
Hmm. So, like, just think when I think about a stroke and people that have had the misfortune to experience such a thing, like, usually they're just at home
Hmm.
doing their usual thing. Like, just imagine you're at home, maybe it's after dinner, and suddenly the arm feels weak,
Hmm.
speech starts to slur, and vision blurs. That's a stroke. So there is a test, if you can't, if you have this one-sidedness, if you can only raise one arm, those are like immediate signals, and the minutes matter. Like, how fast can you get to a
Hmm.
hospital? And it's much greater risk for people in more rural communities that can't get to a
Right.
hospital as fast as someone somewhere else. So then, it's really not something we think about, the association between stroke and salt. It's not like it's not in the daily ponderings.
Hmm.
Oh, if I add this salt here, if I have this processed food, then I'm putting myself at greater risk of stroke. So that's why I thought we'd have this podcast and have a discussion to really bring the awareness, because sodium, whether we think about it or not, is playing a huge role in pushing blood pressure and stroke risk higher and higher.
And I think particularly for the diabetes population, you know, we've talked about the kidneys, that blood pressure is tough on the kidneys, on the
Yep.
filters as well.
Yep. You already have a disease that puts your kidneys at risk. So many things that put your cardiovascular system and your kidneys at risk, with diabetes. Added salt
Hmm.
does the same thing. So think about, like, if your blood pressure is up, it's not just that your doctor is going to be like, oh, that's not good. It's doing damage. It's often called the silent killer because you don't feel any different. Like, if your sugar is high, you probably feel lethargic. You
Hmm.
probably feel like you have a lack of energy. But with salt being high, you might have some temporary bloating. Your ring doesn't quite come off your finger. It doesn't fit well, but you just feel like that's something that's more acute. You don't think that's something
I don't,
causing
yeah, I
damage.
don't think I've ever heard anybody say, I feel like my blood pressure is high. You know, I've
Right.
definitely heard,
You
I
will
think I got low
some
blood sugar, you know, that
mhm.
kind of stuff, but never have I ever, other than, yeah, like, oh, my ring's fitting differently, or I can't get, you know, that kind of stuff. Maybe you see a little bit of swelling around a joint or something,
Mhm.
but yeah, there's not really a good tangible feel for, certainly not, I can't tell the difference between, I only had 1,500 milligrams of sodium today. I'm in the good, and my normal 3,000 whatever. You know that there's no. I'm, at least for me. I'm not sensitive enough to tell the difference between
most people
one or two.
aren't, unless they're in like this hypertensive crisis. Like if somebody has crazy high blood pressure, they could definitely feel like they've got a major headache, a migraine, something like that. But it's not as acute as many other things for sure. So when we really talk about the consequences of a higher sodium diet over time, you've got like just diving into stroke, heart attack, cardiovascular damage a little further. Stroke, you're either gonna, if it does not kill you, which ideally it's not going to be a fatal stroke. However, it can leave you unable to speak, at least temporarily, walk, and it can affect how independent and affect your quality of life. And then
I think tying that back to diabetes, right? When we work with people, the sooner you get on this, the better. The more ambulatory you are and the more capable you are to move, even if it is just the 2 to 5 minutes after a meal or whatever it is, when anytime that you're talking stroke, something's not going to work as good as it used to, and maybe permanently. So when you're talking about something get on an
exercise plan
is
when
seriously
you can't
going to degrade,
yeah.
Potentially eliminate my ability to walk, whatever your goal is for your outcome for healing, that can really limit those positive outcomes. If you're looking to turn this thing around, it's hard to turn this thing around if you can't get up and take care of yourself.
Exactly. And when it comes to a heart attack, if people survive that, because it's the #1 killer of Americans.
Yeah, you're clearly not going to get to remission if you're dead. It's basically.
Right. It's just a lot of times with that, it's like how much damage to the heart was done by this acute event. Like, what are we looking at? Is there any ischemic damage, or is there any damage to the heart tissue? And sometimes people will come out of that with a lowered ejection fraction, which is the ability of the heart to completely empty all of the blood. And when you start to get into reduced ejection fraction, the contractile ability of the heart lessening, not being able to fully empty, you're just not able to filter the blood in the way that your body was designed to, and you don't get as much oxygen circulating, and you feel way more tired. You might thankfully still be kicking, but your quality of life just really declines. And that's the same thing that can happen with kidney damage. Like the damage of high sodium in the kidneys, because the kidneys are going to be the body's sodium filters. They are trying to regulate that and keep it in balance. So you're gonna filter out excess sodium to try to keep the sodium levels in the blood at normal levels.
Yeah. We really try and hammer home the dynamically increased risk to your kidneys if you have diabetes. When for most people, when they start to think about retirement, they're not thinking about what retirement looks like on dialysis.
Oh yeah, if you've got to drive
all the places I want to go and all the things that I want to do, if I've got regular visits where I got to sit down with a machine for 3 to 4 hours, 3 times a week, that is going to put a serious crimp on whatever your long-term plans look like. It's not impossible, but it's nobody thinks about that, certainly in their 30s or 40s, but that's a very common outcome for a lot of people with this disease on a long enough timeline.
Yeah, and the Center for Disease Control estimates that 2 out of 3 people with diabetes have high blood pressure.
Okay.
And I've pulled a couple things out of a study that I think just I'm just going to read it because it speaks for itself. So worldwide, population-wise, 3.95 grams of sodium is what the average worldwide population gets. So I was surprised to know that the world does worse than the United States on average with sodium intake.
So question,
Yeah.
is that tied to, again, just what I would call the deployment of processed foods at scale?
I don't know. I don't know the exact cause, if it has to do with there are definitely lower sodium intakes in many areas that you would consider very in the poverty level, and the higher ones tend to be in less poverty.
In an area without, we have a very high quality of life in the United States. If you don't think so, please get outside the United States and go to some rougher neighborhoods. In areas that maybe don't have, can't go to a grocery store and see every different brand of whatever and all the refrigerated items. Canned foods are very shelf stable and ship real well and are largely inexpensive and that kind of stuff. It's been a pretty effective means of preserving food for a hot minute now.
Yeah.
Is that possibly where the source of a lot of the sodium is coming from?
Possibly. I really don't know. I know the highest place was Georgia, not Georgia, the state in the United States, but Georgia had the highest sodium and Kenya had the lowest. So I don't know what that's attributed to. I know that this study was looking at a meta-analysis of well over 100 studies across, and also epidemiologic studies and food examination survey data. So it really was compiling all that data. So I couldn't say, I can't really answer your question fully. So you can
Once
speculate.
Again, Amber doesn't know everything.
I don't know everything at all. So let me go back to what I was going to quote. So they were saying that precise targets for sodium remain controversial. So in the United States, it's recommended 1,500 milligrams, but then no more than 2,300 milligrams or 2.3 grams.
Okay, so that 1,500 recommendation, that's
the American Heart Association recommendation. Yes. And we're talking about globally with regards to this study. So they're just kind of trying to decide. But what they did find is there wasn't if you get below this amount, it's dangerous. They were not able to find a correlation there, which I thought was interesting. And it makes sense because prior to Marco Polo, we didn't have, were we eating a lot of salt? Were people having a lot of salt? Before the spice trade? I don't think so. But they basically arrived at target levels somewhere between 1,200 to 2,400 milligrams per day based on this study. And this is the part that I really blew my mind. So they estimated that in 2010, a total of 1.65 million deaths from cardiovascular causes were attributable to consumption of more than 2 grams of sodium per day. And that was presented at the American Heart Association Epidemiology and Prevention Nutrition scientific sessions in New Orleans. So it was blew my mind, 1.65 million.
And that's crazy. That's more than, again, you're shifting units on me, 2,000 milligrams a day.
Yes.
Okay.
Yep. Sorry, I don't mean to go all around, but yeah.
Okay. So how do we make it better?
Yes.
What are some things that we can do to avoid the apparently very common pitfalls if 70% of the stuff's coming from foods that we eat every single day? How can we start to make it better? Probably not gonna be able to turn that off overnight. But we can start to maybe make some better choices. What does that look like? This
is my favorite part because the statistics can be grim and it's hard. I've said this before. It's hard for me as an optimist to say, here's the stats. This is what it is. But I think that, and I've said this before too, we're horrible at risk assessment in general. People in general are really bad at assessing risk. And so that's why I throw all the ugly stuff out there that we've talked about prior to now, because you really have to have an understanding that this is out there and this is killing people. And it's so much more dangerous than you might have ever imagined. So, having said that, let's talk solutions. Let's get into like how to change it, how to make it better, what's practical, what's evidence-based, what's actually within the realm of something that you can do every day. So there's a couple of things. Number one is the DASH diet, which DASH stands for Dietary Approaches to Stop Hypertension. This is not new. It's been around, 2 decades or more for sure. And it's one of the most studied heart protective diets in the world, backed by the National Heart, Lung, and Blood Institute and endorsed by the American Heart Association. It really emphasizes fruits and vegetables, whole grains, lean proteins like fish, poultry, and beans, low-fat dairy, nuts and seeds, and really focuses on having minimally processed foods and really not adding salt to the diet.
All right. How is this different from the Mediterranean diet? It sounds like the exact same thing.
Lots of similarities for sure, but definitely a lot more focused on salt. Whereas the Mediterranean diet might have more olives that could be cured and salted. But in general, I think the Mediterranean diet would typically be lower in sodium. It's just not necessarily the focus, but they
don't lead with that.
Yeah, they don't lead with that, but it's definitely a secondary thing that the Mediterranean diet would be a little lower in salt than the standard American diet for sure. And like so DASH has really consistently lowered blood pressure in everybody. You don't have to have diabetes to follow the principles of the DASH diet and lower your sodium intake and thus lowering your blood pressure. So it's really about balancing that. And it's really not too depraving. You don't have a lot of deprivation.
There we go.
In that in that diet. So it's a good start. If you like, a lot of times people are like, just tell me what to eat. I want a menu. You can go to Dietary Approaches. You can go to the National Heart, Lung, and Blood Institute and look up DASH diet, and they'll give you a 1,500 calorie menu and an 1,800 calorie menu. Menus are not my favorite because everybody has their preferences and the food that they like, and I'm just less regimented than that. But some people might want it, and there it is on the National Heart, Lung, and Blood Institute website. So number 2 would be learn to spot the sodium traps. Like really become a label detective. Look at the nutrition facts on the label, and you want to aim for items with less than 140 milligrams per serving. And they might have like low sodium listed on the label. So the FDA says to make the claim of low sodium, it needs to be less than 140 milligrams of sodium, or 140 milligrams of sodium or less to have that claim. Now, when you eat that food, if you always have 2 or 3 servings, that's completely different, and you want to look for that.
Well, I mean, so if I'm having a low sodium serving of beans, and I want to get say 2 servings of beans or something like that, that's still
only 280, but it's more when you get into 3 and 4 servings. It just depends. You want to swap canned beans for the no salt or low salt or no salt added versions of the canned beans. Choosing fresh poultry, fresh fish over your deli meats. Yeah. They're not really deli fish, but you get what I'm saying.
With the
deli fish.
I probably don't even want to ask the question. Like you get your smoked salmon for your lox. Is that?
I don't know. I mean, I would look at the label. I haven't spent a lot of time looking at the label for that, but I don't think it's as high as many other processed.
All right, I'll do some investigation.
All right, report back. And then just when you're cooking rice, pasta, grains, instead of adding salt for flavor, look to herbs, garlic, lemon, things like that. And for me, like if I were to make popcorn, I typically will add paprika or I'll add garlic powder, onion powder, not onion salt, not garlic salt, but the powder versions of those. You can add rosemary. I was going to say raspberry.
Does the sodium content show up on seasonings? I don't know that I've ever checked.
No, it does. They don't have, because typically it's like maybe some anti-caking agents, but in general, there's not salt in there. Unless, now, if you see certain seasonings will have a nutrition facts panel on the back because they do have sodium and they have to list it. But if it is strictly an herb, I think
probably your blends are going to be more at risk. Your Cajun blend, your Italian blend.
You got it. You got it. Then number 3, eat more plants. I know. I feel like a broken record. I know. And as we said in the beginning, these are naturally lower in sodium, but they're also higher in potassium. And that's a mineral that helps balance the effects of sodium.
Okay.
So sodium is pulling water out of the cell and potassium is pulling it into, it's really hydrating the cell. So potassium-rich foods like spinach, beans, and bananas help relax blood vessels and thereby lower blood pressure.
Interesting.
Yeah.
You said that beans help lower blood pressure. Is there anything that beans can't do?
They are the magic fruit. That's the magic piece.
We talk a plant-based, like forget plant-based. Beans is where it's at.
Good for your heart. Yeah. Magic. And number 4.
They're literally good for your heart.
Yes. That's why the song came about.
I don't think that's why the song came about.
It totally is. You might, and your middle school self might have really focused on the other portions of the song, but really I think it came about. It's good for your heart.
Yeah.
Anyway, moving along, number 4, restaurant strategies. So when you're eating out, make sure you get your sauces and your dressings on the side. I will often tell people, dip your fork in the dressing and then get your salad. But even like if you have a salad at home. So you had mentioned at one point when I talked about plant-based diets that oftentimes people just think of a salad when I say that, and that's definitely not what I mean. But if you're thinking of adding in more salads, more greens, not a bad thing. But instead of that Hidden Valley Ranch dressing, sorry, you're like, we don't call out specific things. Sorry. But instead of that, using like balsamic vinegar, red wine vinegar as your dressing base instead of those
just being aware that
prepared.
the dressing is going to be one of those
absolutely
high
sodium in the dressings and the sauces and the marinades and all that stuff.
But do your legwork. Look at what the serving size on the dressing is. And if it meets your less than 140,
how many?
140 milligrams. If it meets that requirement, then use that serving. But use that serving and do not liberally apply, because again, you'll get right back into trouble with that.
Right.
I found that I tend to apply more than one serving of dressing when I do. Sometimes it's happened once or twice.
All these times where I'm like, please don't add the dressing.
Yeah.
I will add it to my own. You pour that whole packet, like in the salad packs.
Yeah.
That's why I behave. My behavior is being explained as we do the podcast for my husband just thinking I'm crazy.
Making sense.
Back
and
to
I just thought you were crazy.
Yeah, back to restaurant. Turns out I'm just trying to live a long and crazy life. So, back to restaurant strategies. When you limit fried and breaded foods, when you limit the bread that can come before the meal, then you're going to limit the sodium as well.
Yeah.
Number 5, track and replace. So keep a 1-week sodium diary. This is one way you can do it, and really notice your top sodium sources. Oftentimes they will pop out like a sore thumb.
So how do I do this if I'm eating out once a day?
It's harder for sure.
Yeah.
Real hard.
Okay.
Because you don't know when you're eating out at a restaurant or you're eating, fast foods are pretty good at having nutrition guides available online. But when you're eating at a restaurant, especially mom and pop type, which, I do love to support small businesses, but when it comes to mom and pop restaurants, they can have a lot of salt, a lot of, in our area, Southern cooking. It tastes delicious, but in terms of health, it's really not always the best.
It's a little bit of a leading question, because this is my favorite of these, is the, getting some awareness about what is going into your mouth with regularity is kind of the first real big step towards, we do not talk management on this podcast because there's plenty of places to get that. When you're talking about reversing a disease 20 years in the making, you're going to have to get good, and you're going to have to get good fast. And there's no way that that's going to happen if you are not going to take ownership of 80% of this math equation is really mastering what I'm eating. And if you don't know, if you don't know the sodium content, if you don't know the sugar content, all this kind of stuff, there's no way. It's never going to happen. This is one of the first things that you're going to have to get good at. And when you start getting good at that, then you start to see some of the other things changing. Awareness is absolutely the first step. I cannot even make a change unless I know what's going in the first place.
A lot of times with diabetes, number one, it's getting out of denial first and into awareness. Absolutely. 100%. So I think that you wanted to add something here in terms of beans and your little shake that you have.
Oh,
you
it was
said
more,
that you noticed all
so
that.
it was more, you've been advocating for beans, and I've been making changes in my diet. And, again, that was the kind of the unintentional fix. Was I found that adding, taking the can of beans, even if it wasn't the entire can, still looking at that when I'm doing my calculations for what's going into the shake, it was one of the major adders to the sodium content of that shake. And, for me, it was just, okay, I'm just going to have to make, dried beans at scale earlier in the week. But that literally was almost like a factor of, I think it was like a factor of 10. It was a lot. Dynamically reduced the sodium content. Tasted exactly the same. There was no, that I could tell, tangible or difference in how the end product tasted, but it did require me to earlier in the week prepare the volume of beans that I'm going to consume over the course of the week. It was a little more legwork than just cracking a can, but
yeah, talk about that, because I think that what you have done in that space is a good lesson for a lot of people that might be listening about what it actually looks like to replace canned beans with fresh beans. So can you talk about what you do exactly?
Okay, so for the dried bean solution, I'm going to give you two versions of it. I mean, the crock pot version is probably the easiest, but it takes like almost a day. There's a good bit of prep work. If you have it available to you, and if you're listening, please sponsor the podcast. The Instant Pot, the pressure cooker, is by far the best way to do this. You take your dried beans. They recommend rinsing them, which is not a bad practice. But you take the dried beans, put it in the bottom of a pot, basically add enough water to cover it by about an inch, maybe an inch and a half. So
you don't follow the instructions on the label of the beans. You just like put it in and cover it with water
Instant
by
Pot
about
is,
an inch.
and again, I didn't come up with this. I did my internet research and all that kind of stuff.
Internet
but
research. You Googled it.
I have,
Googled it.
yeah, I have not. Yeah, but it sounds so much better when.
Yeah, whatever. You Googled it. Keep going.
I Googled it. You know, it doesn't matter the type of beans, absolutely immaterial. It's a 50-minute high pressure cook will make perfect beans.
How many minutes?
50 minutes.
50?
50.
Okay.
So I do that on, say, like a Sunday or early in the week, and you know, it makes enough servings to last the entire week.
So a family of 5,
yeah,
the entire week. Now, granted, our kids don't eat a whole lot of them as much as we would want them to. But
another, and this is just me. I found that if I'm trying to make, like, say, like red beans and rice, I would probably add the seasoning after as opposed to cooking it with. And the reason is, if I make a gigantic batch of red beans and rice, it doesn't get eaten. That's one meal, and then the leftovers are, you know, maybe somebody's pecking a little bit there. But if I just cook the beans, almost all beans, particularly when there's no sodium added, are very neutral when added to any recipe. So if it's just beans, I can add some Cajun stuff, or I can add some whatever else, you know, whatever it is. But I could also add it to a smoothie, and it does not dork with the flavor of the smoothie and that kind of stuff. So I've found that not only is it good at getting the sodium out, it creates a very neutral ingredient that I can use in other stuff throughout the week, and it usually gets consumed that way.
Yeah, a way that I used beans this week like that is I had some Amy's vegetable canned soup. I had 1 can, and I was trying to make enough for me and Judah. And so I used that can of soup plus these pre-cooked lentils and added in about a cup and a half of pre-cooked lentils. And it was delicious, you know, just like that. And it really enhanced just the vegetable soup itself, which was mostly like liquidy stuff, you know. So I think that's great. They're a very versatile staple without a lot of taste other than what you add to it.
Yeah.
You know, it's sometimes it's a good little kind of meaty-ish taste. Like it's nice. But that alone can shave about 500 to 1,000 milligrams of sodium out. And then that takes you from the average of 3,500 to 2,500, which is progress. And it's really progress, not perfection. I've said that a couple times too. That is the goal. Just keep on edging things out. And number 6 is to partner with your doctor regarding your blood pressure if you're on blood pressure medication. So this is something that I see far too often, where we work to increase healthy foods, adding things in, naturally reducing the sodium content by adding more fruits and vegetables. And then the person is hypotensive, so high blood pressure because of the medication. Like if they weren't on the medication, they would not be hypotensive. And they're still on this major dose of antihypertensive medication. So it's about communicating with your doctor. I'm going to be changing my nutrition patterns. Can I track my blood pressure and bring the results in? And if it supports coming down on this medication, like I'm feeling lightheaded, low blood pressure, then I can cut this medication maybe in half and then potentially do away with it over time. And that happens. I've seen that with multiple people, many individuals who have been able to come off of their blood pressure medicine in that way.
We've talked about, you know, oftentimes physicians being very, very ready to prescribe a medicine. I think uniformly physicians want you to get better.
Absolutely. Think about it. If your blood pressure is through the roof, any doctor worth their salt is going to put you on an antihypertensive medication to keep you from having a heart attack or stroke.
So to reduce
it is practicing good medicine
to reduce the blood pressure medication. It's very similar to the diabetes medication. It is a working with your physician to develop an agreement that you are going to make the changes to bring this down through diet and through behavior change. And when we get to a certain threshold, can we come down? That kind of thing. They're not just going to take you off it, regardless of what you're on. You
need to have logs.
You're going to kind of have to show that you're meeting them halfway by reducing whether it's blood sugar or blood pressure. That's going to have to come down. But I doubt that the physician is not going to work with you if they see that you're moving in the right direction.
Yep. And the reason that I mention at-home blood pressure cuffs and doing that is because you can really see change across time, and you have a lot more data to bring into the office. There's something called white coat syndrome, where you could just have anxiety about going to the doctor and your blood pressure is falsely elevated when you're at the doctor because your blood pressure is high. Or if you have a doctor that's in a hospital system, like a clinic in a hospital system, you might have trekked it a half a mile or so to even get to the appointment. So if you've been walking, especially if you walked quickly to get to the appointment on time, your blood pressure could be high because you were just being active. So making sure to sit down for some period of time prior to them checking your blood pressure in the office. Or that you kind of get around all of that by having an at-home blood pressure cuff, which would be your sphygmomanometer if you want to see if they have something online for you to order. And sometimes insurance will cover it, depending.
Yeah. Okay.
Yep. So that's kind of all I got covered.
Well, that was plenty.
Yeah. Okay. So normally you'll ask me like what one thing to do. And that one thing is really like looking at, like really trying to discover where sodium is getting into your diet the heaviest.
It's reading the labels. It's asking, like a lot of restaurants will have their nutrition content online. So doing a little bit of recon from that. And if they don't, if your goal is to reduce sodium, to reduce your blood pressure, there's plenty of restaurants that do have their information that will allow you to make an educated choice. Again, awareness is the very first step. Looking at the labels, knowing what your goals are, and then if it's not in line, making a better choice. There's always better choices. We're not advocating just avoid this or just, cut this out of your diet and all that kind of stuff.
Do this one thing.
Yeah.
Just this one thing.
That doesn't
exist.
Except
maybe, the more that we do this, I think maybe adding a half cup of beans a day, that would be your do this one thing.
But that's an additive, right?
Yes. And often we've talked about adding something to make it better. It does work because it displaces.
Yes. Displacing is exactly right. I fill up on low sodium stuff first. I fill up on, fiber rich stuff first. When I do that, even when I don't want to say make a mistake, even when I make a less good choice, it's unlikely that it will be as big as it would have been if I'm just starving. Just like I know I don't go to the grocery store when I'm hungry, right? I try and get some good choices.
You did the other day, and you came home with what, Sour Patch something?
You know what? You ain't got to talk about that. That's
I felt it appropriate to mention because you did go. That was the only time that you mentioned going to the grocery store hungry.
Airing out the dirty laundry on the podcast.
Sometimes it happens.
Yeah. Yeah. So this is going to be the new thing. It's like you can do
that.
But we're going to talk about it on the podcast.
Excuse me.
Well, this has been yet another episode of the Diabetes Podcast. Thanks for tuning in, and we will talk to you again next week. Here's the bottom line. Sodium's not just about taste. For people with diabetes, it's about life. Too much sodium fuels high blood pressure, heart disease, stroke, and kidney damage. But reducing sodium, even by a small amount, can lower your risk and extend your life. Remember, the goal is 1,500 milligrams a day. Even cutting back by 500 or 1,000 milligrams makes a difference. Focus on fresh, whole foods. Lean into the DASH diet principles. And don't do it alone. Work with your care team, your family, and your community. Because here's the truth. You're not powerless. Every choice matters. Every meal is a chance to protect your heart, your brain, and your future. If you enjoyed this episode, subscribe to the podcast to stay connected with the latest research, expert insights, and practical steps for going beyond managing diabetes and working towards type 2 diabetes remission. Until next time, take courage. You can do this, and we can help.